So, by show of hands, who loves pulmonary function tests? Of course you do. You just like Robert. Okay. Look, I love cookies. The rainbow cookies are like one of my favorite. So put me in a room and tell me to stay away from the cookies, but fill the room with cookies, and I am not going to be a happy camper. So what we're doing is we're testing all of y'all on something you're not good at. I'm not good at staying away from cookies. Of course you don't like pulmonary function tests. They're not going to be fun. And y'all know it's not going to be the easiest thing to do. So I agree. They're not entertaining. They're not fun. They're not great things to go do. But are they necessary for your treatment? Yes, they are. All right. Now, I listened to all of y'all and all the different diagnoses that y'all have. A lot of them are restrictive versus obstructive lung disease. And do y'all understand the difference between that? No. Good. I'm going to teach you something. So, we're going to have some fun today. I'm not about slides and anything boring. So here we go. You get to watch me blow up a balloon.
You're lucky you can.
Exactly. So, at first I was like, all right, I'll hand out balloons. And I was like, no, that's just like doing PFT. So, I'm not going to do that for all of you. All right. So, the air goes in just fine. With obstructive lung disease, when you let your air out or you try to blow out, it's hard for the air to come out because there's something obstructing the air from coming out. So when you hear wheezing, it's the same thing. For restrictive lung disease, there's two different things that could restrict the lung disease. It could either be inside the lungs itself, which would be fibrotic, and that's fibrotic tissues in the lungs, or it could be something in the casing around the lungs, which would be the parenchyma, and that's something that's keeping the lungs from blowing up. So, there isn't an issue with air coming out of the lungs. Don't touch this fine. They're over there. All right. Now, I haven't done this before. I just thought about it. So y'all, y'all can laugh at me and with me. All good. I just, yeah, all these little adapters, huh? Alrighty. So, I made a contraption here, and it might look really funny, but it's going to do the trick. Alright. Wish me luck. What's the problem? Alright, I'm going to hold this side so I can at least get this one blown up. Alright. Now, what do y'all know about compliance? Just in general, not lungs, in general. Compliance. What does compliance mean?
You do what you're supposed to do.
There you go. You're compliant. You do what you're supposed to do. So, if you're doing what you're supposed to do, you are acting properly, right? This one did what it was supposed to do. Well, this one did not. So the compliance in this balloon is correct. The compliance in this one is reduced because it's tougher. It's fibrotic. Something made it harder for it to blow up. thing with COPD, the compliance in your lungs is increased. So you could say this was either normal compliance or increased compliance because it's stretched out a lot easier. This one would be fibrotic because it didn't stretch out as easy. So, I'm going to tell you all the pressure between these two lungs. And what do y'all think the pressure is going to be? Equal?
No.
All right, which one's going to have more pressure in it?
Compliant one.
Which one?
Compliant. No.
All right, I hear mixed. Yellow and green. All right, so I'm unclamping the yellow one. This just measures in centimeters of water pressure. It's a way we measure pressure inside lungs and inside different things. We are up to 23 centimeters of water pressure in the yellow one. All right, I'm going to clamp that off. Clamp it down here. Let's do this one. For the green one. That one is at 20. The bigger one has less pressure in it than the smaller one. So that also shows there's compliance. There's more compliance here. All right. One more thing for me to show y'all, and then we'll talk about it a little bit more. Pull out one more balloon, wherever my bag is. All right, so if the lungs are stiff, like I showed y'all, that's one of the restrictive diseases. But if your rib cage doesn't move freely when you take a breath in, if it's stiff, then that is a different type of restrictive lung disease. That's a restriction as well. All right. So, airways. Naturally, when you breathe in, airways expand. And when you breathe out, they close up. A little bit, not completely. So, why doesn't everyone's lungs wheeze when you breathe out if they naturally go down? Anyone know?
They don't have any obstructions.
Right, and what do we consider as obstructions?
Inflammation.
Good. Scarring from multiple infections. That would be chronic bronchitis. If you have bronchiectasis, where you have multiple infections in your airways, your lungs. Asthma, inflammation is asthma. And secretions, any of all those, that nice sputum you cough up or try to cough up, that's in the way of blowing out. So if you have an airway and you have the lining of it that's either increased or something sitting on the lining, you can breathe in through it just fine, but you go to breathe out, something's in that lining and it really closes it down. It's hard to breathe out. Those are the differences. And one of the biggest things when I was in respiratory school that really surprised me, COPD, you hear a lot about COPD and COPD and COPD. There's only really, there were 5 diseases that were considered COPD. Everything else that has to do with the lungs, which is hundreds of different things, are restricted. So that surprised me because everything, all this research is focused on emphysema and cystic fibrosis and chronic bronchitis and asthma. These are the big names you hear out there. But y'all don't hear a lot about all of the pulmonary fibrosis and the interstitial lung disease that comes with rheumatoid arthritis. Sarcoidosis is another one. pulmonary hypertension. There's all these other diseases out there. But because they're not obstructive and in the forefront, you don't hear as much about them. So, as we went around the room, a lot of y'all have the restrictive diseases. And it's almost split with the COPD, COPD asthma, COPD leukemia, COPD CHF. I was listening to you. Taking some notes. So, when y'all go to the doctor, do you get prescribed inhalation treatments? Inhalers, different ones, or is there like a whole plethora of them, and they're confusing? Do this one so many times a day, this one morning, this one night, this one as needed, this one in emergency. Does it get confusing?
Yes.
Does insurance tell you, well, we won't pay for this one? Yeah, that's a whole compounding factor. It's not very nice, is it? No, it's not. It's very frustrating on our part. So, it's like walking around with this in front of you saying, what does this mean? It's very important that y'all know, and I know this is hard to see. So this is made more for the clinicians like we are. These are all the different inhalers that do the exact same thing right here. All these do the exact same thing. All of these do the same thing, and all those do the same thing. There are different options out there, and what your doctor is trying to do is see what works best for you. So if you're prescribed something, and your insurance pays for it, try it. If it is not working for you, let your doctor know, and let your doctor know, or your nurse practitioner, whoever you see, let them know why it's not working for you. Not just, I don't think it works. I don't feel relief. Or maybe I feel like I'm wheezing more, or I'm not feeling any better from it. Is there another option for me? And as you can see, in the same class there could be a different medication you could take, or it could be even something else. So always have that discussion with your physicians.
So there's basically 4 classes in this, they all fit into one.
They fit into different classes, and some of them are combination drugs. This is a whole combination, and it's 2 of the drugs mixed together. But they mix so many different ones together. And this is from 2016. I'm sure there's more on here than now that they keep coming out with more and more of them. And some of them, these are solely for COPD, not asthma. Well, what if you have COPD and asthma? Well, then you're going to have to carry around a purse with just inhalers in it. Doc, what can I actually do? It's a lot. I went to school to learn this. Y'all shouldn't have to try and learn how to continue living your life. Some of these medications last 3 hours. Those are the ones you use to rescue you when all of a sudden you're short of breath and you can't get your breath. Those are these right here. That's your albuterol and your Zopanex. Atrovent is in that class. It's not as fast acting.